Have you been up to West Virginia already, some?
About 3 times. However, technically the teachers don't go into the 28th, and
Now,
then
wait a second. Where's the
then the
mute button
kids
on this
report
phone, just in
the-
case he ticks me off?
8th or 9th. 8th, I think.
That doesn't help me, Tammy.
He said they were getting electrical storms below the mountain.
I don't see a mute button. Yeah, I do.
Hello,
Mr. Haynes?
I'm here.
All right, we're
You're
gonna
what
get
now?
ready in just a second. We have the microphone, pulled up to the telephone.
Yeah.
If you'll just identify yourself as you vote, okay?
Are you ready now, or wait till they call the meeting to order?
Wait just a minute till they call the meeting to order.
Very good.
Thanks.
You're looking good tonight, Mr. Haynes.
Yeah, I'm never better than when you can't see me.
Joey, I kind of feel bad. I need to confess something. For years, when you sat beside me, I always wished you had a mute button, and now you do, but I wouldn't wish this on anybody.
Well, I'm going to tell you what, guys. I'm talking on one phone and I'm watching each of you, and I tell you, it's a whole different perspective. There's nothing that's going to go under the table tonight.
Sort of like being at the Miss America contest or something.
I guess so. But thank
Just
y'all for
overwhelmed
accommodating.
by the beauty, I guess.
Okay. Well, Tammy, are we ready to go live?
Yes, sir, you're live and we're ready.
Okay, well, we'll call our school board meeting, our August 11th school board meeting to order. And if possible, Mr. Campbell, would you lead us in the pledge and invocation?
I pledge allegiance
To the flag of the United States of America,
And
to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Justice for all.
Let us pray. Dear Heavenly Father, we thank you for the many blessings you've given us since we last gathered together. More than ever, we want to thank you for the people that you brought together to work for our students in Carroll County, and we're thankful for the facilities that you provided us to work in. Most importantly, we continue to be thankful for the children that you've entrusted to our care. As we continue to work together tonight to plan for the upcoming school year, we pray that the adversity presented in this challenge will serve to bring us together as a united group working for a common cause. We ask again that you bring healing to those amongst us that continue to deal with the many issues presented by the pandemic. Finally, as our leaders come together tonight to do the business of Carroll County Public Schools in what remain extraordinary times, we ask that you provide them with the wisdom necessary to make good decisions, peace to live with those decisions, and the humility to always seek your direction and guidance first. In your name we pray, amen.
Amen.
Okay, our first order of business, we will need to have a vote to approve the participation of Mr. Haynes via electronic means. Medical, I guess emergency or medical reasons is keeping Mr. Haynes from attending in person. And so we would need to approve that participation in order to, for him to continue. by
Mr.
the
Chairman, I move that we accept the virtual participation of Mr. Joey Haynes.
I'll second that motion.
Okay, well, that being the case, all in favor, raise your right hand. Do I can see? All right, motion is passed here. Mr. Haynes, welcome to the meeting.
Thank you, gentlemen. Thank you for accommodating me. And for the record, this is Joey Haynes participating by phone.
Okay, well, I know we're having recognition of our county art fair winners. I don't know if they're here in person. But anyway, our kids did a super job and were recognized for their artwork. And I guess Mr. Campbell is going to do that.
Happy to share with you tonight that we had 3 Carroll County Public School students represented at the 2020 Virginia School Board Association Regional Art Forum. We did email invitations to those 3, mail invitations to those 3 students to participate tonight. We made phone contact with those folks yesterday, and they were just not able to be in tonight for several different reasons. But very appreciative of the recognition that we are going to provide. I'm really proud to share with you Mr. Quint Leonard from Carroll County Middle School placed first in this art show, best in show. At the elementary level, we had a 3rd place Virginia School Board Association Jasmine Lineberry, and then at the secondary level, another 3rd place Bianca Camp. So just some fantastic work done by those students, and very proud of the efforts of both of them. Thank you very much.
Okay, well, thank you, Mr. Campbell. Okay, you gentlemen have before you the agenda. So do I have a motion for approval of the agenda?
Yes, sir. I'll make a motion to approve the agenda as presented.
I'll second.
Okay, all in favor, raise your right hand. Okay, motion passes. Mr. Haynes?
Yes.
Okay, thank you. Public comments, of course, will be at 6 o'clock if we have anybody that has, I guess, signed up to for public comments tonight. And we'll check with that at 6 o'clock. And again, remind everyone that that avenue is open via email. And Ms. Questenberry, I guess, would handle those questions if they are presented that way to her. Okay, now, consent agenda. Again, you guys have the minutes from the last meeting and the approval of bills. Do I have a motion or for approval of the consent agenda?
I'll make a motion to approve consent agenda.
I'll second that motion.
All in favor, right hand up. Okay. All right, approved. Consent agenda is approved. Action items. We have the continuation of the VSBA Policy Services Program. Dr. Burnett.
Yes, sir, Mr. Chairman. I'd recommend that we approve the continuation of the VSBA Policy Services Program. We've been participating in the NAP for a number of years. It's a very valuable service that we get a lot of mileage out of for the price. And just would recommend that you guys approve that.
Any discussion or questions?
Mr. Chairman, I move that we approve that the VSBA and policy that was given to us.
Okay, we have a
I'll
motion.
second that motion.
Second. All in favor, right hand up. Mr. Haynes? Okay, motion is approved. And we will continue the VSBA Policy Services Program. And we now have Dr. Burnett, the SRO grants resolution.
Yes, Mr. Chairman, there's a resolution in your packet that supports our SRO and SSO grant program and funding that we receive to keep the resource officers and the school security officers in our buildings. It's been a very valuable program. I know right now we're funding 2 of the security officers out of this grant. And then I think the Sheriff's Department is paying for one of the SROs out of the grant as well. It's just a very valuable program that we don't want to lose.
Do we already have that grant money for this year?
Yes, sir, it's approved. We haven't received the allotments yet, but
It's on a reimbursement
yeah,
basis. so quarterly we apply for reimbursement for it.
But that's probably one of the things they're questioning as far as continuation. So that would be good for us. That would be a good deal. Okay. We have a motion, or do I need I need a motion to approve this resolution that we have in your packet, supporting the SRO grant program.
Yes, Chairman, I'll
I
make
move that we adopt the resolution supporting the continuation of the SRO grant program and funding.
Okay, we have a motion.
I will second that motion.
We have a second. All in favor, right hand up. Mr. Haynes.
I'll say aye.
Okay, motion passed, and I think hopefully that will help that program continue if enough people get out and let it be known. Okay, now we have the report of the superintendent, Dr. Burnett, opening of schools.
Thank you, Mr. Chairman. I just wanted to talk about a few things that we've had going on most recently. We've had our new teacher in service and new employee in service last week. I was glad that a lot of you could attend that. We have a very good crop of new teachers. A lot of Carroll County graduates that are there that replace some of the folks that have retired. We've had our system-wide convocation today that was virtual. I don't know if you got a chance to participate in that, but Mr. Hendricks, myself, and Mr. Quessenberry were all recorded, and we gave our welcomes, and then we provided the staff with a asynchronous professional development system provided by Whitfield Community College. A lot of different classes that they could sign up for and workshops they could sign up for that ranged everywhere from equity in education to Google Classroom to the helmet clinic at Tech. We had the folks in the helmet clinic at Tech do some work with demonstrations and all about data collection and all with some of our teachers in that. Had a lot of reading, had a reading in service, wasn't it, Mr. Campbell? So we've had a lot of good things going on today for our staff. Also, just wanted to let you know that, we do, our plan is to open school Monday. Wanted to kind of review our path back, our path forward for our reopening. I've asked Mrs. Frost here to address any of our health questions or health concerns that you may have regarding the reopening of schools. Right now we have a little over 900 students enrolled in our virtual program.
And we do get financial credit for their membership.
Yes, sir, they count on our ADM.
Right, great.
They count on our ADM. So that we have about 2,700 students, roughly, probably a little less, probably more closer to 2,600 coming back in person on the hybrid schedule. As a review, we introduced the hybrid plan to where we bring back kids in A group and B group, with the A group students reporting on Monday and Tuesday, and B group students reporting on Thursday and Friday. Wednesday is a virtual day for all students, and teachers will work in the classrooms half a day individually with those students to provide any kind of remediation or enrichment or answer any questions. We'll also use Wednesday as a cleaning day to clean between the A group and B group. On the Friday evenings will also be a cleaning day to prepare for A students to come back. So we're going to perform our health checks at the door when the students arrive at school, but we're also going to ask parents to perform health checks at home with the students before sending them to school, before they put them on the buses. There will be a school reach message go out at the end of the week explaining that. So as far as any questions that you may have, I'm going to invite Ms. Frost to the podium, if she would, to answer any of the health questions. Mr. Martin.
a child is on virtual, if there's a vaccine developed or not developed, could those kids participate in the functions of school, athletics or debate club or whatever? Could they still?
Yes, sir,
do that?
they can return at any time.
No.
You know, as soon as the vaccine's developed or whenever they want to return, if they find out that maybe the virtual program's not for them and they want to return, just however. Some of the concerns I know that people have is are the health concerns. And I've spoken at length with Dr. Shelton and Julia Banks, our epidemiologist for the Virginia Department of Health, and we know that we're going to have some cases. It's inevitable, and the key to containing those cases are the safety protocol that we put in place. And at this time, I would like Ms. Frost to come up and answer any questions that you guys may have.
Thank you. I'm going to give you a copy of some very important information. That is the health plan, the health reopening plan. I know it's on the district site, but I would just like for you to have it to refer to if you would like to ask any questions.
I don't have the virus, but I've been working in the fence row, and every weed is fully developed. And
Well, we will have you to look at that symptom checker right there.
oh, okay.
You can check it out and see if you have it. Okay?
Let's say a child has a temperature and they don't come to school because of the temperature, and we had a cap of you can't miss more than 10 days, but they don't have COVID, they have a temperature, they don't come. Are we going to look at that max miss schedule of 10 days?
Well, if they bring in a note, you know, there's going to be an excused absence.
Okay.
And we do have some flexibility with our attendance policy right now
Okay.
due to the COVID. You're talking about the virtual students or the students on the days that they're not at school that are supposed to be attending virtually. If they log in and to the computer, or if they complete an assignment, or they participate in a Google Meet session, that's indication, that's called a work process documentation that they were at school. So we will count those towards attendance at school.
So if my daughter was Monday, Tuesday, and she had a temperature and we didn't let her go into school, she could do work online Monday and it'd be counted?
Yes, sir. As long as, you know, we've got where she logged in, or she may have sent an email to the teacher or something to that nature.
And we do have attendance recommendations in the health plan. And daily attendance will be monitored in Power School, and it will include virtual and students who may be at home for illness. And those parents and guardians are going to be encouraged to notify the school like normal and let us know if their child's going to be there, what the reason may be. We have points of contact for each school, and that's going to be the administrators and the school nurse. And we would like for that information to reach us so we can know what is going on with the students and their health. And we still are going to be using the codes in Power School, and we actively are going to encourage students and staff who are sick to stay home. And because we want to protect everyone's health and safety at all times in the school system, not just now, but every single day. And we are going to work, the school nurses will work with truancy officers like normal and let them know what is going on with the situation at our schools, and be very informative to them, and let them know if we have a cluster and we see kids missing and what's going on. So the attendance recommendations are in our health plan also. And we have always been doing this anyway, working with the Power School with the attendance, and working with the truancy, and letting everybody know, the administrators, what's going on with health.
Yeah, I just know some parents, if their child has a headache, for example, they're not going to take the child
Right.
to the doctor and I know as an employer, I can't ask my employees right now because of the COVID new laws, that if they miss work because they're sick, we can't ask for anything, which normally we have asked for documentation. But now they can miss anytime they want to. You just have to forgive it and make, you know, and be
One
short,
of the,
you know.
school will go on like normal, and we already monitor students' absences, and the nurses are in each school, and we communicate with the parents and guardians really on a daily basis. And I myself watch the attendance daily, and I even look and see, oh no, someone missed 1 day, now it's 2 days, now it's 3 days. We make parent contact every day.
I just know some parents are so touchy, and if they got a truancy letter because they were going by this list and they were trying to be cautious, they're gonna be on the defense side.
And we did discuss that, and we do have other, plan in place for that, and more understanding. And the truancy officer was on the committee also, and we talked about this.
And the directives from the Department of Education have loosened quite a bit just
Absolutely.
because of the COVID-19. So, you know, you won't find that it's as strict a policy as it was before.
So our advice to parents is err on the side of caution.
That is right,
Don't worry about the truancy part.
100%.
I'm
Excellent.
tickled to death that we're using tremendous flexibility in the program we've offered. It gives something for everybody, and I just don't think it's the time to be real hard-nosed with the kids and the parents in this
And we want to
epidemic.
keep open lines of communication. We are a healthcare employee, and we like to know what's going on, positive interaction with the parents and guardians, and that is our job, and that is what we do every single day. And we are the buffer for some of this, and able to talk with truancy and let them know what's going on. It is a much different situation than we've had before.
Well, please let your staff know how grateful we are, because we know that a nurse at a school system is not doing it for the money. Because they could do a lot more at the private sector, and they do it just as a passion for children. And I can't imagine what they're gonna be going into the next few months.
Thank you so much. That is much appreciated. I will let them know.
I have, I guess, a couple of questions, which we know we know it's gonna happen when we have students to show up with the temperature. You know, whether it be less than 100 or above, you know, may not be that 100.4 or whatever, but if they show up with a temperature, how do we, I know you haven't a plan, but would you kind of tell us what you do with the kids, or how you kind of take care of that?
I sure will. First and foremost, I want everyone to know, when the kids come to school, I don't want them to be stressed out and worried about the symptoms and the temperature, and it will be handled very discreetly. And we will have scanners in the school. They're very cool. The kid walks up, puts their wrist up. The temperature shows on the other side, where a staff member would be monitoring that. If we did have someone identified with a fever that is 100.4, then the school nurse will check that individual very discreetly and take them to our office, like we always do. If they have the fever, once we're gonna recheck it with the oral thermometer. And we would do as we always do. We would do an assessment of the child, use the symptom checker, and notify the parent or guardian that the child has a fever and symptoms and needs to be picked up, and they need to go for medical treatment. And we will have an isolation room at each school, and that's where we would have the kid wait if they had a fever.
Does that handle multiple kids?
Well, it doesn't handle multiple kids because we can't have them in there together, but the VDOE guidelines state that we have to have an isolation room.
Right.
And we do have one designated at each school site.
Okay, I guess, I'm being kind of skeptical in that, all the parents may not screen their children you know, or maybe they develop the fever after breakfast or something.
Mhm.
You wind up with, you know, 2 or 3 kids, especially in, you know, as many kids that show up at the elementary school, the middle school, or even especially the high school. You know, are we gonna be prepared to deal with multiple children with temperature?
We will be prepared to the best of our ability. We also would have a clinic where we could also have someone wait. We also could ask for another room if we had to do that. I have been with the school system for 23 years, and I was there for H1N1, and we kind of already had that same thing, and we would have kids at school with temperatures, and we would have to find a place to isolate them. I'm sure the administrators are going to 100%, I absolutely know this, I'm not sure, but they will help us find a place.
Even
that's-
if you have 2 kids with a temperature, if you could socially distance them in one room?
We
that's
can't.
all- That's a
No,
lot.
we can't socially distance them with temperatures together.
Wow.
But everyone is all in this together, and I'm sure the administrators are going to help us if we had this situation on any given day.
And I guess, kind of sort of, again, being devil's advocate, we have students show up a second day with the temperature. Parents come and get them, that come back tomorrow, same thing. I guess then, I know we can't force a
Right.
a test, but when do we say, you know, what do we do on the repeat case, I guess, you know?
Well, first and foremost, we have to understand that not everyone with a temperature of 100.4 will have COVID.
Right?
And that is why we have got the COVID-19 self-screening questions for staff and students. And that is going to be on our district page. We are handing these out at open house, and then I will be making a school reach from the head nurse to speak about this. We are doing the best we can with the guidelines that we have, and we do have good guidelines in place. And on a normal day, just exactly what you asked me, I have dealt with that before in flu season with kids who come to see me on Monday, they have a fever, I send them home, I suggest that they go for treatment, they come back. Maybe they didn't have any way to go to the doctor. Maybe they didn't have insurance. Maybe they didn't. There's a lot of things that play into it, and we would notify the parent or guardian again. Try to find out maybe what the reason is that they didn't seek treatment and go from there. And we do that in every case, not just for COVID.
But we do have the health department available
Yes,
to
we
us as
do.
well, that they can be screened at the health department.
And they can. But for your question, that does happen.
Well,
And we
again,
try to get treatment for them.
Ordinarily, you know, a kid show up with a temperature and a headache, you know, it's not an alarming event, so to speak. But now, you know,
Right.
everybody is going to be alarmed, or a lot of people, you know, alarmed. And I guess I'm just, I'm really, I hope that it goes well. We don't see a lot of this, but I just wanted to kind of, at least wise, but pose a bad case situation in the event, you know, and
Right.
you know, I know if the parents do all they're supposed to do, and everybody, you know, and everything goes, we'll be better off. But if there's failure in the system somewhere, or the, you know, the process breaks down, then we will, or I say we, the nurses are going to be stuck with the consequences.
We have also, like you was saying, if the kid come back and it was their second day, the school nurses work very well as we possibly can with the community doctor's offices, health department, with the parent and guardians. And first, we would find out really what the situation is,
Right.
and use all the resources that we have to get help for this child. And sometimes, as y'all know, we're the only health person they ever see. But we would do our best to try to get help for this student.
Can I
Straws.
interject a question?
Yes, go ahead, Mr. Haynes.
Hey, Joey Haynes. I know it's impossible to have, I guess a cookie cutter answer to this, but what is it? And this is what I seem to hear from so many people. Is there some standard or some trigger when you have one child, and then I guess the bigger thing is what about the other children that that child has had contact with? You know, a lot of the questions have been about how do you deal with that child or children in a family. But these kids are going to be in a group. These kids, again, they've been following the standard on the bus. But what triggers like notification or the watchful eye of parents or guardians for other children if there's a child that, I know you don't give out the name, but just the fact that, there may have been, there's been this issue. I know a lot of parents are like, well, we'd like to have some idea if we need to be more watchful or more diligent about, about watching our children if there's other children showing symptoms. And is there a way to address that, or is it all going to be tied to these telltale signs that we all hear so much about?
We would be following protocol that's in our plan, going by the guidelines from CDC and the VDH, and they would tell us what to do in that case.
Okay, so it'll be dictated by the circumstances.
Okay, yes, it would be dictated by the circumstances, and I need to look at this for just a minute to see what page I want to talk about. And that's going to be the protocol that we follow. And just give me a second. Okay. I'm going to read the protocol to you. I think the question you really want me to answer is this part of the protocol. Suggested guidelines for returning to school or work with the illness. Is that what you're talking about, or do you want me to tell you how we're going to notify them?
No, I'm as long as there's a mechanism. But I guess I was just curious because I know what a lot of people are thinking is they'll do these things and then how long do we wait? But what should we know and when? You get what I'm saying?
For notification,
Yeah.
we would follow these guidelines. We would notify the parent and guardians per letter, and that would be done by the division superintendent. And we have form letters from VDOE, and that is what we would be using for that. And we
And
have
that would be
specific
for other
guidelines.
children that had some close contact with a prospective, ill child.
Mm-hmm. All of the nurses are going to have been trained in contact tracing, and that is what
Okay.
actually you're referring to. And
Yeah.
notification letters with guidance from the Department of Health or the VDOE will be sent to the entire community of parents and guardians and I'll read those out to y'all. Number 1, a symptomatic student or staff was sent home for a COVID-like illness. Number 2, a report of a positive case but not exposures in school. Number 3, a positive case with exposure in schools. And notifications will be done in a way to protect the confidentiality of the ill student and will clearly explain what actions the school has taken in response to the diagnosis and what the recommendations are for teachers, staff, parents, and guardians. And then we will have regular updates following an initial notification, even when no additional cases have been identified. And teachers, staff, and parents and guardians will be kept apprised of developing situations in which more cases are found and more stringent measures are planned to prevent the spread of the disease.
Okay, that's great.
Mr. Haynes?
Just for people to know how that'll flow, and so thank you for explaining that.
You are more than welcome.
Mr. Haynes, one other thing that we probably need to address on this is defining what exposure is.
Yes.
And, when they assess that risk of exposure, it means close contact and being within 6 feet of a person with COVID-19 while not wearing adequate protective equipment for longer than 15 minutes. It says, if you're within 6 feet of someone that has a lab-confirmed COVID-19 diagnosis for 15 minutes or more, then that person is considered to be exposed.
That is correct.
Yes, sir. Yes, right. Thanks. Again, my main purpose in that was for anybody listening, watching, or if it gets reported, it's just, I think it's good for people because everybody's so anxious. It's just good for them to, to know that. So thank you for that.
Well, this information was not in our packet, was it?
It is in the plan. There is a link. It's been there the whole time.
There's a link. Right,
Yes.
there's a link in the plan. Well, I saw that earlier, and if you, I guess.
We can put it, I do have a health page, and I'm
Well,
going to put it
I
on
just
there.
wondered, Mr. Haynes can find that,
Oh.
the link, that was on.
On the
in our-
reopening
in our
plan, on
reopening
the
plan,
district
yes.
site.
So
It is there.
Yes, I saw it.
It's little,
But by the same token,
but I did print this off for you, because
Right,
I
yeah,
know
well,
that link.
I kind of went back and looked at the plan, and that's why I asked for a little more details, which were in a lot of it was in the links.
Mm-hmm.
And so this information is going to schools, to parents, right?
This information is,
Are they gonna get this instead of having to rely upon them to go to the computer, to hook it, to look to the link? Again, many of our folks may not have that internet access to find that link.
She's going to give them a copy of the small paper, not that big document. You send that whole big document home, I don't know how many people will
Right,
read it, but.
just the particulars with, we're talking about the kids.
Yeah,
that part.
she's got that, do you have a copy of that handout right there?
yeah,
that she
y'all
sent
have
it
those
home?
with you. I've got them in English and
Yeah,
Spanish.
okay, that was, I just wanted to make sure because, everybody may not even take the time to go to that link, and then read through all of that. And so if they had something and they can't say kind of sort of, I didn't know,
I understand. We have the self-screening questions for students and staff that we're handing out at open house and the symptom checker.
right?
And I worked on this for 5 hours, okay? It was not an easy thing to make. And I wanted people to only have to keep up with one piece of paper for the whole school year. And that is what this is. And the students will have one, and the nurse will keep the form for all the students, and the staff will keep their own. And that's their own personal piece of paper where they've recorded their temperature and they've checked their symptoms prior to coming to work.
Okay.
I would like to share something with you. I've worked really, really hard on this, and my whole theme for this is keep it simple. And that is wear a mask, social distance, and wash your hands. And every parent I talk to, or every student I talk to, or any staff member I talk to, I will always repeat that. Because if you get people too bogged down and worried about this and this and this, they just give up and don't listen to what you're saying. So I want everyone to know that we need to do those 3 things.
Everyone will have to do their part if this is going to be successful. But as administrators, I believe we must be prepared for the part that goes sideways. Knowing in the event that everybody does not do their part and we have an upset condition, I just wanted to kind of make sure that we had already thought about it, or, I say we, you and the staff, administrators, and then had an idea of what we're gonna do. It's not like everybody runs around and looks at, I don't know what to do. At least wise we have an idea, we've thought about it, and like to have something in place, kind of suspecting that we may have an upset condition before it's over with.
We do have a plan, and we have had numerous planning meetings, and I've listed for you the people on my committee, and they are right on the front of this plan, and it represents a lot of different people, even a parent. And we have a plan at the administrators seminars for our back-to-school meetings. I presented the plan. I've presented the plan to the nurses. I've talked about this plan nonstop. And we do have a plan. We do have one.
Well, I knew that, but I wanted to make sure that everyone else knew that.
Right.
We aren't going into this blind or unprepared. I say we, again, Dr. Burnett and all the staff, the work, we do appreciate that very much. And we know that a lot of it is going to fall upon you and your staff because you're going to be the frontline folks. But anyway, thank you very much. And it wasn't that I was looking for holes in the plan. I just wanted to make sure that everybody kind of knew. And so since, there are people that are watching this remote, to make sure that, we do have a plan, and we've looked at these what-ifs and doing the best we can, and then, of course, with the guidance from the state and the local health departments, we'll do our best to keep the and our staff safe. I think that's that's a major concern for a lot of people, is just the safety, and we're doing everything the best we can. And I thank you, Ms. Frost, for all your work and the whole, the whole staff. It's all the committees, the folks. It's been all summer, a project working all summer to get ready, and so we're as ready as we can be. And I just thank you all very much for all the diligence and all the hours spent. And if we can make it through this without anybody getting sick, it'll be well worth it.
That is exactly right. And I just wanted to add one more thing. I have trained a lot of people this week regarding COVID and OSHA training and bloodborne pathogen and first aid and CPR training. We do a lot of trainings, transportation, maintenance, the custodians. I have done trainings at my school. I have trained IT, RT, technology. I have visited all these people, and I done my own presentation with COVID, and I have extensively talked about it, and I had an open question session for people to ask me questions about it. And I have an open door policy. Any parent who wants to talk with me, if y'all want to talk with me, if anybody wants me to explain that plan, I will be more than happy.
Well, that's, in the event that, there are questions come up, they can contact, you or the nurse at school. But anyway, we all want to feel comfortable with what we're doing. And if we can't feel reasonably comfortable with what we're doing, we probably shouldn't do it. So I'm very grateful that, that we've done all this homework and done all the preparation and all the training, and we are comfortable. Like I said, we'd have to vote no school if we didn't feel comfortable. Now, that's my opinion. So I guess, thank you again very much. Does anybody have any other questions?
I've missed it. Or what about masks? The kids are not wearing masks in
The kids
school.
are going to wear masks. They're going to wear masks to ride the bus to school. They're going to wear a mask to enter the school. They are going to get their breakfast, go to homeroom, and they will have their mask on. When they get in the classroom, we have to maintain the 6 feet, which we have the desk marked off for 6 feet, and then the students can take their mask off.
And they put them on when they go to the lockers and they intermix in the hallway.
They would put them on if we had any time that they would be closer than 6 feet. But we are monitoring the hallway situations and the bathroom situations, and we're really monitoring all situations with social distancing and doing the best that we know to do.
I guess bottom line is it would be very easy for us to tell everyone to stay at home and let's do virtual learning for everyone. However, is that the best thing to do for the children? And that's the decision, that's the hard part of this decision that we have to make. We're gonna do everything we can to ensure the safety of the kids, and we're not naive. We know that we're gonna have some cases in the division, and it's gonna be how we handle them is going to make the decision as to whether.
Mr. Martin?
Okay, well, again,
And the
this
fact
was-
that I had her in the second grade, it
I
doesn't
know he's
enter
gonna
into-
tell it. He was my PE teacher.
Yeah, anyway, so.
1820.
This is a presentation, only. We've already approved our plan, and we're still on track, right? So if Dr. Burnett tells us that we're on track, and Ms. Frost tells us that we're on track, we're ready to go. So anyway, I appreciate the info and all the work, for sure. And, a whole lot of work in advance saves work later, so hopefully we've got most of that over with. Thank you.
Thank you for asking me here, and any questions that y'all have regarding health, please contact me. I will do the best I can to find an answer if I don't know.
Good job.
Thank you so much.
Thank you.
Thank you.
Chairman, this mic drives me crazy. We do, we do have a plan, and I guess the big thing of it is if we do have an outbreak and we do have to shut down schools, at least by starting early now, we can send our kids home better prepared to learn through Google Classroom. If you remember last time, we just shut down school. There was no training for the students. So this is going to give the teacher a better chance to be more familiar with their students, their learning styles, and how they're going to utilize Google Classroom when those students are home. So hopefully, if nothing else what comes of this, is at least we'll be better prepared if we have to shut down.
Yeah. And I,
We're
and
a
I,
little more nimble now, aren't we?
yeah, that's true. And I appreciate those comments, because, most certainly, like all of us, I've really wrestled the last month with the thought of pushing a start date, or not pushing, not the thought of having the conversation of, should we be pushing the start date back till after Labor Day, for instance. But in talking with Dr. Burnett yesterday or today, it really made me feel good. I think that's just a very good point, that once all the schools are in, I think it's being said, well, we know we're gonna have some cases. And if we did wait till later, and you have those cases in the community around, we may not get in school. But I do think that the point of having some time in school is critical if we have to go to virtual. I think that's a very good point, and most certainly appreciate that. Because I do agree that we'll have some cases. We would be amiss probably not to think that we will. So, being prepared if we have to shut down a wing or a classroom or a school, having the kids prepared and the teachers better prepared will be invaluable. So, appreciate that.
Okay, well, I guess we're on track and ready to go, looking for an open house. So, at this time then, Ms. Crestberry, our financial report.
And just so we can back up to public comments, we did not have any, I do not have
Oh.
any emails, and I do not believe we have anybody signed up, so
Yeah, well, like I said, we ran over with that, but
That's-
anyway.
we'll back you up for a second.
Thank you.
You have your July financial report in your packet. July expenditures are typically, very low. It's just 12-month staff, some opening of school, type items. You will see that we have spent, a considerable amount in health services, and that's buying a lot of PPE, items for return to school. We've spent a little more of our maintenance budget than we typically do with this year, and again, that's cleaning supplies, everything that we're doing just to make sure that we are prepared for the start of school. Revenue typically in July is from the state. That is our 12-month allocation until our AVM is counted. We also have received our transfer from the county. We are anxiously awaiting the special session that the governor has called. It starts on the 18th. I think there'll be a lot of talk about finances at that session. So we'll see how that pans out at the end. We did budget for $34.60, so we'll see what it looks like with the opening of school.
Can you send us daily, like you do in the
We
past?
can, remember, it's gonna look a little different
Yeah.
this
But,
year.
yeah, include the 900.
Yes, by the time we count the virtual, and then you have A students, and then you have B students, so it'll look a little different this year. But we're absolutely gonna monitor that.
The first
We
week.
have a good handle on the number for virtual and how to count them, so.
Thank you.
good. So be happy to answer any questions.
Everything went okay. Y'all went to the Board of Supervisor meeting last night, right?
They did not discuss they did not discuss school funding, but we are meeting with Salah tomorrow.
Oh, okay. Well, the rubber stamp.
Okay. Any other business? We're ready for closed session.
Hang on just a second.
I've memorized
You have it
this, but
memorized?
I hate to embarrass people
You
and
got it
that have to
memorized.
read
You're more
it.
than welcome, so. Okay, pursuant to section 2.2-3711A of the Code of Virginia, I move that the board convene a closed meeting for the purpose of discussing the following specific matters. Tammy, you may have changed the one I had from last month, but I believe it's the same. The discussion, consideration, or interviews of prospective candidates for employment, assignment, appointment, promotion, performance, demotion, salaries, discipline, or resignation of specific public officers, appointees, or employees as authorized by section 2.2-3711A1. The discussion or consideration of admission or disciplinary matters, or any other matters that would involve the disclosure of information contained in a scholastic record concerning students is authorized by section 2.2-3711A2.
Okay, motion for closed session.
I'll second.
Have a second? All in favor, right hand up.
Aye.
Mr. Haynes?
Aye.
Okay,
Yes,
we're
aye.
going to closed session.
Joey, we'll call you upstairs, so give us just a few minutes and I'll call you and set you up there, okay? Oh, okay, we'll call you in just a minute.
Mr. Chairman, I guess it would be, you'd recommend if someone had to call in, not to be
That's
talking in a
okay.
bathtub
We don't have any personnel.
or,
Yes, you do.
We do,
Yes.
but it's not on here.
Should be.
Yeah.
Okay.
It was on there. It is his dog eating gummy bears is the noise.
It's up here on that.
a likely
The
story.
bottom one
Ready, Dad.
doesn't have the attachment. I
There
don't
we
know
go,
why.
okay.
It's not a lot to it, but.
No,
Well, I
it's
didn't figure we'd do
kind
it
of
this
cut and
time of
dry.
year.
I was wondering if we wanted to even go upstairs, because that was how the fun thing was.
Well,
We can sit here, it doesn't matter to me.
well,
Whatever
yeah,
works.
suppose we just close the door and turn,
Might close the
call
door.
back, yeah.
Well,
Close the door,
We
turn
just,
off the
we
light.
just have to
Come
get,
work and-
we just have to get Mark back.
Because it's such a little report.
Okay, I'll
Miss-
go grab him.
Thank you for
Mr.
that
Chairman.
information.
That
Yes,
letter
does that
for,
help?
Thanks, sir.
the religious exemption,
Be safe.
that is, she put some time in.
Mr.
Oh, that's right.
She did, didn't
Did
she?
we, are we off,
Thinking,
TV
my
off?
heavens.
I'm
And you
getting
know,
ready to.
the sad thing is, and I'm not saying that of her, but if you get a parent that has mental illness,
Hello?
and you're
Hi, Joey, we've got you back on speakerphone.
from getting,
Yes, I'm good, thank you.
Mr. Chairman,
Just a
We-
second, guys.
after a certain age, the child could speak, you know, because you